Can we move on? Achha, okay. Can we move on to the next, Dr. Somak, sub-silicon oil ERM removal?
Good afternoon, everyone. The topic is sub-silicon oil epimacular membrane removal, a better alternative for early post-operative immature macular membranes. So, epimacular membrane or EMM are common after vitrectomy. It is actually ERM developed around the macula. It is a sign of post-operative PVR, vitrectomy with silicone oil, often unable to restrict its development. Oil removal and membrane peeling may be a choice, but it is usually delayed till the retina is stably attached. The membranes often jeopardized visual recovery as it obscures the macula. So a different technique to remove the immature membranes is applied under the silicone oil, keeping the oil in situ. Thus, this sub-silicone oil removal of epimacular membrane facilitates clearing of macula. It provides better visual recovery and maintains the natural healing process. Also maintains good tamponade effect till retina is stably attached. Later oil removal can be done as required and as per choice. So purpose was to evaluate the visual improvement in silicone oil filled eyes after performing sub-silicone oil epimacular membrane removal without removing the oil. So 10 eyes of 10 patients included in this 2-month prospective interventional study, all undergone EMM removal without removing the silicone oil. It is basically a 2-port approach and no infusion system was used. That is, it's a dry procedure. Follow-up done at 2 weeks and 4 weeks. Pre and post procedure vision and IOP was measured. Pre and post procedure enhanced depth imaging OCT, that is EDI OCT, was done in all cases. Visual improvement and different parameters of anatomical changes like epimacular membrane status, foveal architecture changes, neurosensory retinal status were evaluated before and after membrane peeling. The presence of cystoid macular edema and the anatomical changes of regression, resolve and persisting CME is noted. Any complication is also noted. So the results, the mean pre-procedure vision was 260 and post-procedure vision was found 645. The range is 160 to 624. Epimacular membrane was resolved in 80%. CME resolved in 50%. Persistent CME was noted in 30%. In one eye, it was mildly regressed, and in one eye, it was rather increased. Foveal atrophy was noted in 50% eyes, and thickening of fovea seen in 20%. Recurrence of subfoveal SRF seen in one eye. In one eye, neurosensory RD was resolved. Mild perioperative hemorrhage was seen in 30% that resolved subsequently. Minimal data is available in literatures regarding this procedure. This method is rather unique as it keeps the tamponade in situ to provide extended support for a desired period. Significant regression of epimacular membrane was noted. Definitely it helped to regain effective visual acuity. Associated foveal atrophy should be looked for as it may hinder visual recovery and has a poorer prognosis. So to conclude, the sub-silicone oil epimacular membrane removal for early post-operative immature membranes is a better alternative to gain effective visual improvement without hampering the desired tamponade effect. It is safe and easy to perform and requires minimal manipulation. Thank you.
When did you remove the ERM? After a surgery, when did you remove the ERM?
Sir, it depends on the ERM status. If the vision is hampered, I can do it even 2 weeks after the primary surgery, because I am keeping the oil in situ. So at any time post-operatively, I can do it.
So what was the mean duration of removal of ERM in your particular subset?
Mostly 4 weeks.
You don't have the data?
Yeah, I have not given that data, but it is.
And how long did you
4 weeks.
retain the oil after that?
Ma'am, it is again depends on the situation and scenario. Usually we remove the oil in 3 to 4 weeks on average, 3 to 4 months on average. So I can keep on keeping that. But some patients require some long-term effect, so I keep them for 6 months. The oil is there for 6 months.
No, why didn't you remove the oil at the first go if the retina is stable? Waiting for 2 weeks or 4 weeks does not make a difference.
No, sir,
and you can remove the oil after 4 weeks and simultaneously you can
definitely
see oil will give an hypermetropic shift. The vision improvement will not be good. So if your purpose of attachment is done, then why can't you remove the oil at the 4 weeks interval or 6 weeks interval?
No, that is
Why have you chosen this method?
Sir, this is the early removal of oil. That means before retina is stably attached, or I am thinking the retina is not attached stably.
Then you will have an immature membrane. The problem removing at 2 weeks, either see there are two things that you have not removed the membrane at the time of surgery, so you are intervening at 2 weeks. But if it is a PVR changes, the membrane will take somewhere around 4 to 6 weeks to mature. And if you remove as early as 2 to 4 weeks, then the reoccurrence of membrane can also occur.
Yes, sir, that
and
can happen.
You are adding one more surgery to the patient. How does it add to? I know what is the advantage you had from the conventional method. If I wait for
Yes,
2
sir.
more weeks, what
Yes,
is the advantage from now to then?
Sir,
Why did you go for this
the
technique?
first thing is, initially we are supposed to remove or used to remove the mature membranes. In conventional process, we remove the mature membrane because the one thing, retina is not stably attached. So we have to go for silicone oil removal, and then we have to go for the ERM removal. But in early cases, I think there is no harm in removing the immature membranes, as the
Chalo,
retinal
thank you. Next.